Welcome to your prenatal discomfort video. Today we will be going over conditions such as chronic aches and pains, fatigue, tired legs, headaches, heartburn, indigestion, and a couple more. We're going to start with the most common ailment, lower back pain or sciatica. It's important whenever you're going through the pregnancy that the hips stay open, the low back is open, and the spine has mobility. This way, if the hips and low back and sacrum area are open, the nerves at the base of the spine have space and room. So I'm going to show you one of the best poses in a seated position, and then we'll make our way to all fours. So bringing the soles of your feet together and seated on a prop. Today, Jenny and I are sitting on bolsters, and you can also sit on a block or pillows. So I'll demonstrate with a block in between the feet. This helps to open the sacrum even more. Jenny will have the soles of her feet together. Make sure that your space is wide enough for baby. So the heels will probably have to scoot a little bit more forward than you're used to. And from here, any arm position is comfortable. So we're going to just go ahead and take the fingertips on the outside of the feet. Take a deep breath in, and as you exhale, you'll just crawl the fingertips forward, begin to roll your body down into a forward position. So as you're here, you may already feel discomfort in your low back or sacrum. Take a deep breath into the low belly, into the low back. And as you exhale, feel the entire spine start to decompress, noticing that your face is getting a little closer to your feet. And begin to feel the spine lengthen and release as you move into your forward fold. If this feels good and you'd like to take it a little further, use your brain to begin to press the thighs down towards the ground. If that isn't available to you, you can take the elbows on the inner thighs and gently guide them down towards the ground like so. Stay here for about 3 to 4 more breaths, taking about 10 total. And allowing the breath to massage the low back, to open the hips. We'll take one more big breath in. And exhale and release. To come out of this pose, inhale, lengthen the spine, pull your heart forward. Exhale, rise all the way up. Good. So that is your low back sacrum opener. That one is very common. Most of the time it is done seated on a propped up position. So I want to show you a hip opener. I'm going to demonstrate it on the floor, and Jenny's actually going to demonstrate it in a chair. So we're going to begin by opening the right hip first. If you're seated on the floor, place your right ankle over your left thigh. If you're seated in a chair, same thing. Your left foot will remain on the ground, but your right ankle will cross over. For many of us, this is enough. If you would like to go a little further, you can begin to hinge at your hips, starting to come into more of a forward fold position. One of the common ailments from this is a little knee discomfort. So if you are feeling any whatsoever, flex your toes by drawing your toes back towards your knee. Find your hip opening position, and then go ahead and close down the eyes. And you can find a little rocking movement if you're seated on the floor from side to side. We call this rock the baby. And then if you're seated in the chair, just moving into stillness, and we'll take about 5 breaths here. This posture can be done if you're at work, in your office chair, if you're on the sofa watching your favorite program, or when you're coming into your yoga practice. Make sure to do a hip opener at least once a week to keep your body from experiencing any low back pain or discomfort. Take 2 more breaths in your hip opener. Lengthening and sitting a little bit taller if you're on the ground, and allowing your body to fold forward if you're in a chair. And then when you're ready, go ahead and lengthen through the spine, come all the way up. You can straighten your leg to release out of this position. And go ahead and roll the ankles, and we'll switch sides. Take your left ankle, place it on top of your right thigh, and then you can find that rock the baby position again. And when you're ready, go ahead and come down into your fold and close the eyes and just notice any differences between the right hip and the left hip. This one may be tighter, this one may be more open. Take a deep breath into your low back and into your sacrum. Allowing the muscles around the hips to relax, allowing the knee to open a little bit more towards the floor. And remembering if there's any knee discomfort whatsoever, you can flex the toes. Take your last 2 breaths. Inhaling through the nose and exhaling out of the nose. And we'll take one more deep breath in. And then as you exhale, slowly rise up. Straighten the leg if you're on the floor and go ahead and give them a little shake. So now we're going to keep moving and working with lower back issues, hip issues, and then going into heartburn. So let's make our way onto the mat and coming into an all-4 position. So the spine is one of the most important factors to keep in mind throughout the pregnancy. So you want to make sure, starting once again from the base and working our way up, that your knees are a little bit wider than hip distance apart, that the wrists are stacked directly underneath the shoulders. So you can see here there's typically a big sway in the back. We call the all-4s position kind of optimal baby position. Baby's in a hammock, everything is resting in correct alignment. But if you are experiencing back discomfort, finding cat-cow is going to help move the blood throughout the entire spine. So as you inhale, arch, look up, stretching the front of the throat, feeling this sway back position. As you exhale, tip your tailbone down towards the floor, round your spine, pressing right in between the shoulder blades. And then keep going back and forth, inhaling and arching, shoulders slide down away from the ears. Exhale and round, navel to spine, chin to chest. And we'll go ahead and do that 2 more times. Inhale and arch, tailbone tips up. Exhale and round. 1 more time. Inhale, arch, look up, shoulders slide down. Exhale and round. Let's find a resting position. Soles of the feet come together. Knees are wide enough for baby to rest in between your thighs. So keep in mind throughout your entire pregnancy, depending on what stage you were at, that there should be no pressure on the belly whatsoever. We need baby to have complete freedom and complete space. So as Jenny comes into child's pose, we begin to open the hips, open the sacrum. This feels really nice in the entire back, as it also does open up the chest and the shoulders. So this posture can be done anytime. Even during labor and delivery, you may want to find yourself on the all-4s position, working with your breathing practice and moving into the Kegel exercises. This posture can be done on all 4s. It can be done in your bed. Make sure that when you come into this position, you're still directing the breath to the lower belly, lower spine. Stay here for 2 to 3 more breaths. And then go ahead and make your way out. Come to have a seat. And working with heartburn, it's important to make sure that the chest, the shoulder area are open. So when you are coming into your cat-cow, you will find that your first little heart opener is here. That posture is going to help you throughout your pregnancy, but it can also be done seated in any position, whether you're on the ground, seated on your hips, inhaling, finding that arch position. So we're going to do that a couple times. So seated on your heels, hands resting on your lap. Jenny can put a block underneath her hips. That way, if the hips are a little higher than the knees, there's no pressure on the thighs. So we'll start at neutral spine. Exhale all the breath out. Inhale, arch your back, open the thoracic spine, look up. Exhale, direct your body back to neutral. And again, inhale, arch. Shoulders come back, throat opens. Exhale, body back to neutral. We'll do that one more time. Inhale, arch. Exhale, spine to neutral. You can find this in any seated, comfortable position. You can do it at work or at home or during your daily practice. So now let's move on to one of the last common side effects during pregnancy, and that is headaches. So we typically feel the pressure and the weight on the belly. It pulls the shoulders down. We begin to increase the muscle tension in the entire back. So we're going to work on neck rolls, neck circles, and lengthening the scalene muscles, the muscles that connect your shoulder girdle to your skull, either sitting in a chair or sitting on a bolster. Make sure that you feel good. So we want to shift the awareness from the lower body to the upper body. If you're seated on a bolster and you would like a little hip support, you can even take your blocks, place them directly under your thighs, and have that extra added bonus. So taking a comfortable position with the hands, go ahead and close down the eyes and come back into your breathing. And all of the breath typically until labor and delivery is done in through the nose and out through the nose, steady stream. Take a big breath in, and as you exhale, gently drop your left ear over to your left shoulder, and feeling the stretch across the right side of the neck. Take a few breaths here, seeing if you can feel the shoulder blades relax down away from the ears. You can even play around with the position of the chin by reaching it up slightly towards the ceiling or lowering it down towards the chest. And just allow this to feel good in your body, feel like a massage. And on your next inhalation, gently bring the head back to center. And we'll switch sides as you exhale and lower the right ear to the right shoulder. Begin to breathe into the left side of the neck, guiding the shoulder blades down away from the ears and feeling the stretch intensify just slightly. And once again, you can go back to playing around with the position of the chin, reaching it up towards the ceiling or lowering it down towards the chest. And take one more breath here. And this time we're going to exhale the chin down towards the center of the chest, pausing for a moment, and then begin to roll all the way over to the left, stretching the right side of the neck, taking your neck circles, reaching the chin up towards the ceiling, down and around, and do that a couple more times at your own pace. As we open the muscles along the neck and the throat, we're able to get better blood flow to the brain, which helps with headaches, helps with dizziness. And then the next time the chin finds the chest, rest there. Take a full inhale through the nose, and we'll switch sides, going ahead, moving to the right, opening the front of the throat and the neck, exhaling down to the left. And just moving slow, feeling this freedom here. You may notice little pops or little cracks. That is absolutely normal. The next time you bring the chin up towards the ceiling, exhale, lower the chin back to neutral. Take a deep inhale, shrugging the shoulders up to your ears and down your back. And do that a couple more times. We're bringing the shoulders up and down. And we'll do one more for neck tension, for headaches. So finding a forward fold that will decompress the cervical spine. So if you're seated in a chair, open your feet really wide enough for baby to rest in between the legs. As you inhale, lengthen up through the spine. And as you exhale, lower the fingertips down towards the floor and feel a stretch in the back of your neck. If you're unable to reach your fingertips to the floor, you can use blocks and place them right underneath your shoulders. If you're seated in a chair, same thing. Keep the knees wide enough for baby. Take the hands or the fingertips down to blocks or the floor. Relax the back of the neck. Begin to feel the decompression behind the cervical spine. and noticing the crown of your head reaching down towards the ground. You can find a gentle shake of the head, no, and you can shake it, yes. Even open the mouth, wiggle the jaw from side to side. And take your last 2 breaths here. We're also getting a lot of blood flow to the brain. And on your next inhale, look up. Exhale your hands to your thighs and come all the way back up. We're going to end with one final restorative posture. This will help with any aches and pains in your legs and feet, swelling, fluid retention. This one can be done for up to 15 minutes a day. It's nice to end your practice with this. This can also be a resting posture for you, and we're going to go ahead and build it together. Let's go. We're going to set up by creating a little ramp, and then I'm going to have Jenny go ahead and come right where I am. And you want to take your bolster and place it directly on top of your blocks. So you do not want to lay flat on your back during pregnancy. You want to be at an incline. This is also really good if you have indigestion or heartburn, so that the acids can settle down and digestion can go a little bit smoother. So Jenny's going to place her sacrum, the 5 fused vertebrae at the base of your spine, and she's going to come to lie back. So now we want to find a position where the feet and ankles can be elevated either level with the heart or slightly above the heart. So for today, I'm going to build a ramp so that Jenny's legs can be higher than her heart. So I'm going to use 2 blocks on the medium level. You can also take them on the highest level. We have an extra bolster, so taking the bolster on top of the blocks, and then taking the feet once again, going back to the fundamentals of the base alignment, feet hips wider than the heart. So you can see here, Jenny has a wider base with her feet. The feet are elevated above her heart, and now we're able to drain the blood back down into the hips, drain the lymphatic system. And this also is really good for keeping you healthy throughout the pregnancy. So anytime there's an inversion or position where the feet are elevated above the heart, we drain the lymphatic system, which is the tiny white blood cells in your body that keep you healthy, fight colds, fight flus. So this will keep your immune system working better and also relieve the achy feet, achy, tired legs. So make your ramp. Go ahead and come to lie down just so that you can feel this. And this is used every single day. So I suggest using it every day through your pregnancy, or at least 3 to 4 times a week. Once you find the support of the bolster on your low back and sacrum, find any hand position that is comfortable for you. So either taking the hands to the belly, placing the hands by your side like Jenny has, or you can even fold blankets. Take them by your side and make a little ramp for your arms. You can make this as comfortable as you would like. And as you lay down and get comfortable, go ahead and close the eyes. Take a deep breath into your low back, and as you exhale, feel your low back really supported by the bolster. And begin to feel the entire back side of the body softening and resting. And then as you inhale, breathe into the belly, breathe into the chest. As you exhale, allow your legs to get a little heavier, allow them to rest. And if anything does not feel good, definitely adjust or move positions. So you want to make sure that in your inversion and in your relaxation of leg posture, that you feel good and that this is a relief. So as you continue to breathe and relax into this posture, feel free to stay here however long you want. Make sure that your breath is directed down to baby, down into your belly, and you're feeling the back body relax and soften.